Hi everyone, I'm Hindi from Greypawsandall, and today I'm really looking forward to this conversation. I'm joined by Dr. Erica, a veterinarian specializing in hospice, palliative care, and end-of-life support for pets. She's a certified hospice and palliative care veterinarian through the International Association for Animal Hospice and Palliative Care, and provides in-home care focused on comfort, quality of life, and compassionate guidance for families. Her work is deeply rooted in supporting the human-animal bond, especially during one of the most emotional and difficult stages of a pet's life. Through her own personal experience and professional training, she helps pet parents navigate these decisions with clarity, empathy, and as little regret as possible. Welcome, Dr. Erica. I'm really excited to have you here.
Thanks, Cindy.
Before we jump in, I'm just going to give like a little warning. We're going to be talking about euthanasia, and I know it's such a hard word to hear, and it's a tough subject we're going to be talking about, but I think it's really important. So if you can't watch the whole thing, don't worry about it. You can watch as much as you can handle in that moment. Watch a minute, watch 2 minutes, whatever you can, come back to it later. And also, there are timestamps at the bottom of the video, and they're going to be divided by the sections that we talk about, so you can skip through to whatever is appropriate for you at that stage. So, Dr. Erica, thank you so much for joining me.
Thank you. I just wanted to take a moment too and say how grateful I am to be here. This is my passion, and I have a lot of information that
Great.
I have prepared to chat about. Hindi had sent some questions in advance so that I could kind of gather my thoughts, and I have them jotted down. So from time to time, you might see me kind of looking down to just refresh my memory on some of the things that I want to share with you guys.
Same here. I have to read off my paper. So, to start, I think we should just talk about briefly what is the difference, if there is a difference, between hospice and palliative care. And if there is a difference, what is it? And also, we talked about this just briefly, is there a difference in the services a regular vet can provide at this stage as opposed to what you offer?
Okay. So, when we think about hospice and palliative care, they're often lumped together. And ultimately, what it means, it's more of a philosophy of care where you are shifting your focus from curing to comfort. And another idea in this philosophy of care is that the patient isn't just the pet in these in hospice and palliative care. It's the entire unit. So my unit of care as a hospice and palliative care veterinarian is the pet parent, pet caregiver, pet guardian, however you see your role in your pet's life. I generally don't say pet owner. I just don't find that resonates with me.
Right,
So,
me either.
um, and the pet. And so much of what goes into hospice and palliative care is communication based, surrounding what's going on with the pet, education surrounding that, and also really talking about how people are feeling and coping and managing with these changes to prepare your heart and your mind for what's to come. So I guess that doesn't ultimately answer
It does. No, no, no.
yeah, because I'll go on just to say
Sure.
it's an interdisciplinary team. So generally we're looking at the client, the hospice and palliative care veterinarian, a technician, a professional mental health professional, and or any other kind of spiritual advisor. That we kind of all work together to address all the various aspects of end of life care. But palliative means focusing on comfort. You could palliate at any point in time. It doesn't mean it's end of life. So, for example, if a pet tore their ACL or their cruciate ligament in their knee, and instead of going the surgical route, they went the medical route, which is usually rest and anti-inflammatories. That is essentially palliating your pet. So
So,
you go through
okay.
a measure of comfort care in that time frame of their life, but they get over that and then they continue to live their life. Whereas hospice care does mean end of life.
So surgery for a cruciate ligament would not be considered palliative.
I mean, in a sense, yes, it is because it
Okay.
is providing comfort but it is, curative. It's just that what I'm trying to say is palliation doesn't necessarily mean end of
End
life.
of
It's
life.
it's just about promoting comfort in any stage of life.
I feel like we think it does mean end of life. I'm generalizing, but I think
Oh, absolutely.
that's the impression. Okay, thank you for clarifying that. That's so important. So, um, I was gonna say, let's start our conversation. We've already
Well,
started, but
actually, Hindi, if I could
yeah,
just elaborate a little
of
bit
course, of
further.
course.
I think a lot of the time when clients or people approach me about concerns with their pet's quality of life, a lot of the times with dogs, it has to do with mobility. And so we'll do a quality of life consultation, and when we end it, we've determined their level of pain and we can improve it with some pain management strategies. And so that's entering into a palliative care.
Right. Okay, perfect. So I wanted to ask you for, because we throw around the term quality of life, and I think it means different things to different people. And I would imagine it also means different things depending on the condition of your dog and what's going on. So can you just explain what it actually means if there is a definition? And also, I'm going to ask you the next question in case we kind of get into that one. Is it, and I already just actually said that, is it something that looks the same for every dog, or is it, like I just mentioned, more of an individual?
Okay. So in general, I would say that when we talk about quality of life, we're really talking about a pet's ability to enjoy their life, not just to exist, but actually experience comfort, connection, and moments of happiness. That's kind of the general gist of quality of life. When we look at a definition of quality of life, I would say it's how an animal's disease, disability, or changes related to advanced age affect their physical, social, and emotional well-being. And so often, we as pet parents focus on the physical changes that we see. But when we bring in a bigger, wide lens and we look at their life, it's not just the physical changes, but how that influences or impacts their emotional and social well-being. And it absolutely is different with every dog. So, for example, maybe a highly active dog, maybe one that is in agility, for example.
Mm.
If they don't have the ability to enjoy that type of lifestyle, that's going to very much significantly impact their quality of life versus maybe a dog that is more of a couch potato and prefers to be at home and is like, a little bit more on the lazier side. Then mobility isn't going to impact their quality of life in in such as much of a meaningful way as another dog. So really it's all about asking, can whatever's going on, can they still be that version of themselves in a meaningful way?
So are there common misunderstandings pet parents have about that term? I know I see a lot, like in my Facebook group for senior dog parents. I do see a lot when they're very focused on food and
Mm,
eating, and they use that as real. Oh no, but my dog's still eating. I mean, you read like horror stories, but my dog's still eating. My dog
yeah.
was eating until the last moment also.
Mhm.
And I think they don't, and also I don't think well, in my experience, when we've talked about quality of life, we tend to forget the emotional.
Yeah. Um, I think that is very valid, actually. The still eating comment or still purring for cats, still wagging their tail,
Yes.
or they're not vocalizing, they're not yelping, they're not crying
Yes.
out in pain.
Yes,
I
that is a
think
big
those
one.
are all big misconceptions or misunderstandings surrounding quality of life and pain, because they really do go hand in hand. We want to avoid suffering for the best quality of life possible. Um, and there are so many different parameters of a pet's well-being that we have to take into consideration the whole picture. And so to just focus in very narrowly on appetite, well, all the other things are really bad. They're not engaged with you anymore. They're 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 in pain. They're not really moving around much. Maybe they're soiling themselves, but they're still eating.
Yes.
Is that really truly a quality of life for them? Is if they could control the other aspects in their life that aren't going so well, would they want that back? Would they want that ability to be able to move away from where they've accidentally soiled or not soiled themselves at all? Um, so I usually, when I'm talking to my clients about end of life, and we've gone through the different tools and quality of life scales, and we've scored them, and they're high. They score high in appetite, and they're still eating. I often have a conversation with pet parents just to say, I want to let you know that it is possible with the progression of your pet's disease that they may still be eating, as you said, Hindi, even on their last day. And that is often really hard for pet parents to wrap their mind
Mm.
around because they feel like um, they would feel better about the decision if they were no longer
Yes.
eating.
Yes.
And I try to reframe that as think about the experience that you get to have with your pet when they're still eating in their last days. You get to feed them all the things that they haven't had before. You get to have that steak dinner, the bacon grease. They get to have whatever they want in the morning. Maybe even try some chocolate, like so reframing it into a positive thing that they're still eating rather than but they're still eating, so we should
Mm.
continue going on is very important and valuable for families to understand.
Oh, I love that. That's really, yeah, that's good. I think sorry if I ask questions and we've kind of touched on this in a previous question, but from your perspective, and we've talked about, but you may have something to add. What really matters most to a dog's quality of life? Eating, playing, wanting to go for walks. And I know we said it depends on the dog, but is there something that's kind of general?
I think absence of pain, well, not absence, because let's be honest, at this point, there will be some pain. So it's more about coping and managing well with the pain. Um, it is important. Um, but usually what I do is I turn that question around in terms of what matters most, and I turn it around to the family.
Mm.
And I ask them, what matters most in Ellie's life? And when they sit with that and think about it, a lot of times, not it's not always a physical thing that comes up. It's being with me. You know what matters most to my dog? It's being right beside me. When I come in the door, she greets me. When I move from room to room, she's my Velcro dog. She's with me. She wants to be there.
Mm,
And that's what matters to her, being around me. And so when she's not around me, when she doesn't care, when she's not greeting me at the door, when she just lifts her head up and then goes right back again, when she can't get up, move over to where I am, then go move to where I am in another room, or we're settled for the night. Maybe we're on the couch, we're watching TV. Where's Ellie? Is she in the same room with us? Is she on the couch with us like she usually is, curled up right beside? Or is she somewhere I can't even see? That is really in it's individual. It's what matters most to that pet. And sometimes food is what matters most. What
mm.
matters most? Oh my gosh, they absolutely love their food. And that is what matters most to that pet. So I do think that is important. Another, thing that people might say is being outside. They love the fresh air. They love smelling every little thing on their walk. That's what matters most to them. So when we start to see changes away from that, that they're not happy to go out on a walk, or that they're not, sniffing at as many things anymore, that starts to make us question what is going on in their world. Um, But as I mentioned, from a vet's perspective, breathing, breathing comfortably, and pain levels and mobility, I think need to be prioritized more over other categories and or parameters of quality of life.
Are there simple things, and again, we've probably already talked about it, but are there simple things pet parents can look for that will give them a clear indication that their dog is still enjoying life? But I also know that, you can't see because you're so in the middle of it and you're so emotionally invested in you can't always see the changes.
Hmm.
And we just like if we sometimes when someone says like they write a post in the group and they don't know what to do and it's so obvious what you need to do and it's not obvious to them. And I always say to them, reread your post as though someone else wrote it
That's good.
because
Yeah.
it's like you wrote this horror story.
Mm.
Do you know? And I cry, it breaks my heart. So we're so in the middle of it, but is there something that they can do, look at, notice that will indicate to them whether their dog is still enjoying life? And I know you said like, oh, my dog always wants to follow me and now he can't.
Hmm. Hmm. I think some simple things that pet parents can look for, whether their dog is still seeking connection with them, like I said earlier, enjoying the familiar routines or just having those small moments of joy still within their life. Again, I usually um, ask pet parents to reflect on what they're still enjoying in their life, and what remains of their personality. Because when I'm talking to families about their dogs, a lot of times they'll share things like, "Oh, he used to really like doing this. He used to." I hear
Mm,
that. And so then I say, okay, but what does he still enjoy? Or what does he still do? Or what still makes him him? So I think that is an important part of like a simple thing that you can kind of reflect upon. Because really, as pet parents, you know your dog's personality best. You know their normal behaviors. You know their routine. And looking at, are there changes that kind of deviate away from their normal? how significant are those? How many changes are there away from their normal? But as you said, Hindi, their normal keeps shifting as they get older,
Mm,
and you're just used to the way that they become. So
right.
it is hard to take a step back and reflect on that.
Is there a way for senior dog parents to tell the difference between what's normal part of aging and what's actually a decline in their health?
That's a hard one again, because like we have those blinders on, but I always say that age is not a disease. And so, you know, there is going to be a certain amount of slowing down that's expected with age, but the question is, what does that slowing down look like? And could this slowing down be related to uncontrolled or unmanaged pain?
Mm.
And so most of the time when I think or hear the word slowing down, it's mobility that
Mhm.
comes to mind, but it could also be cardiovascular. So, for example, if they are going out for walks, but becoming winded on
Mhm.
their walks and really like panting a
Yeah.
lot, not able to go as far, or like they've gone on their walk, they come back, and they just stay like like asleep in one spot. The rest, they're done. They're
Yeah.
done. And then maybe
Yeah.
the next day is like a write-off. That is not slowing down. That's pain. So I think when we get into that time frame, it's so important to be able to have those conversations about the changes that you're seeing in the slowing down that you can then relate to a vet who can then help educate about what they're seeing on physical exam that could be correlating to what a pet parent is seeing in the day-to-day lives of their pets. And then I think it's always of benefit when in doubt, treat for pain, do a pain trial. So a pain trial looks like providing pain medications that offer relief for pain. And two things we're looking for. One, we want to make sure that the pet can tolerate the medication without any negative effects. And two, we want to see that there is a benefit, that we see some improvement and maybe they're jumping more onto the couch or they're walking up the stairs better now. Sometimes, though, in that 2 week period of a pain trial, pet parents aren't quite sure if they noticed a difference. So we stop, we discontinue it and say, okay, we tried it and we didn't really notice anything. Then like a week later, they'll call back and say, oh, now I'm seeing that they're really like struggling. So there was a change. I just didn't necessarily fully see it, if that makes
Mhm.
sense. Um, I just want to look over what I said here too, because another one for slowing down is sleeping more too.
Mhm.
That's okay. That is to be expected. Sleeping more is okay. Um, but what are they like when they're awake? That's the question that we have to look for in the slowing down.
And this would be a good, what's the word I'm looking for? Another good reason why they should take their dogs to the vet at least every 6 months. Obviously, more if they're managing a condition, but not just once a year like you do.
Yeah.
Twice a year for
Things
sure.
happen fairly quickly in seniorhood.
Yeah.
Um, I think there's four things that are very important in assessing if your pet's slowing down is pain or just assessing pain in general. And that's a combination of all of these four things. The one first is a vet exam. The next is observation of behavior. And in terms of who is the best at that, it's a partnership between what you're seeing at home as the pet parent, and then when the dog comes in to the vet clinic, or if you have a mobile vet coming into your home, watching and observing how a pet behaves. It's going to be different at a vet clinic, we know, but
Yeah.
the way that they walk, at least, is something that we can really hone in on and help you with. You see the way that they hitch there? Do you see the way that they posture at that where they stand and they're shifting their weight more onto their front limbs and their back end is down a little bit more. Do you like so we can show those changes that maybe as pet parents we don't really appreciate or know because why would you? You don't need to be as a pet parent educated on all these things. That's what a veterinarian is for. Um, the third thing is using pain scales. They are very educational. Um, my favorite pain scale is the BEAP, BEAP pain scale. That was done by Shay Cox, and it looks at 8 different categories in your pet's life that are like physical changes, um, or specific behaviors. And then it breaks them down into numbers like 0, then 1 to 2 is mild pain, 3 to 4 moderate, 5 to 6 is moderate to severe, 7 to 8 is severe, and 9 to 10 is the worst possible. And this is what that scale kind of looks like.
Okay, I've never heard of
And
that.
and as you can see, like I know it's a little bit, blurry
No,
right
yeah,
now, but
you
as you
can
can
see it.
see, like a dog that is free of pain, everything is up in their way that they are. Like their ears are up, their tail
Mm,
is up. Whereas as a dog goes through more pain, they
right,
start to turn more inwards. We start to see changes like furrowing of their brow. Maybe their ears are held flatter, their tail might be tucked. Um, that they when they're lying down, they're like just more inwards. They're not as engaged in
right,
what's going on around them. So the 8 things there are breathing, eyes, ambulation, which is how they walk, activity, appetite, their attitude, posture, and palpation or touch. So then there in each one, there's a little written thing like, they're breathing normally, may pant intermittently. Panting's often noted, possibly with an increased breathing effort. Then I describe what that looks like. What does breathing effort look like? In the severe pain, there's faster breathing rate with more noticeable effort. Frequent panting episodes are common. Um, so it just describes each of those specific behaviors or physical changes in more detail. And then the fourth thing to evaluate pain, as I mentioned earlier in the pain trial, is response to treatment. If we treat for pain and they improve, then we know that pain was there.
right. Are there early signs that a dog's quality of life may be changing? And I mean like really early, and I'm going to combine it with the next. And I don't know if I can combine it, you can tell me, are there signs that are often missed or misunderstood? So
Hmm.
if you think that's two separate issues, we'll answer them separately, but the early signs that they could start to take notice of.
Hmm.
I mean, the thing is, I have to say I'm very good at that because I always know my dogs very well, and the slightest change, it's like something's going on. I know there's something.
Yeah.
And I don't want to say that people miss it. I think again, in my experience with the senior dogs that I deal with and that I've worked with, they think it's a natural part of aging. So even if something seems like a little different, they often assume that, well, that's normal because my dog is 12 now.
Right. Um, Okay, well, what I had in mind was again looking back at the 3 domains of well-being or quality of life, the physical, emotional, and social. So for physical changes, I think a change in mobility is really important. And what does that look like? It doesn't necessarily mean all of a sudden your dog is limping. That's more in the severe end of
Right.
pain,
It's already
right?
advanced by then.
Exactly. So, what are the subtle changes in mobility that you could look for? It might be like just a couple missteps, maybe going up the stairs. They still can go up and down the stairs, but there's a couple missteps.
Mm.
Or maybe when they're at the stairs, they hesitate for
Hmm.
just like normally, but there's this like little pause, or maybe even like that kind of motion, where it's
Yeah.
like, okay, I got to figure out how I'm going to navigate these stairs in the way that hurts the least, right?
Hmm.
That's what's going on there. Um, it also could be in jumping up to say the couch. There's maybe like a hesitancy there as well. So that would be some changes that I would see in the mobility before you get to full on like limping.
Yeah.
Um, hygiene, grooming. I see this one definitely more so in cats than in dogs. But cats who have arthritis in their back, trying to groom
Mm.
themselves in their back end, so you really can see that unkept coat
Mhm.
looking. And also, one of the interesting things is nails too, right? Because cats specifically really, really work on cleaning their nails and the wax that accumulates there. Some dogs too, they will bite their nails to maintain their nails. And so it's seeing that their nails are dirtier, especially in the back end for cats. When you go to trim their nails and you see that wax build up, that's definitely a sign of pain. Um, and then for dogs, with respect to hygiene, but incontinence, that's down the road,
Mhm.
if it's pain related. Um, but that posture, right? The posturing to pee or poo, that it's harder for them to do that because they're uncomfortable.
Or boys
So
don't lift their legs. They start
exactly,
squatting like a girl.
exactly. Yeah. Um, with respect to appetite, definitely being more picky. Maybe so some people will put the food out all day and then their dog will graze. So that's fine. How do you know when they're not eating as much?
Mhm.
So is it that when you go the next day and there's still kibble left in the bowl, or there's more kibble than there usually is, they're not eating as much? For those who are meal fed, again, not finishing off their meal, or just really choosing to be more picky and wanting the canned food or table scraps over their regular food, that can be an early sign. I do think worsening of any ongoing symptoms, or things that were previously controlled for chronic diseases, or any new symptoms are of concern, and that's all in the physical realm. In the social realm, it's being less engaged. So, like before, when I said maybe they always, always, always would come and greet you. Now they're not greeting you. They're maybe looking their head up, maybe they're wagging their tail, but they're staying in that spot. Um, with respect to other household pets, maybe there's a change in the dynamic there. Maybe there was one pet, one dog that they didn't really get along with very well. Whenever that dog would come and want to play, usually a younger dog, right?
Mhm.
Want to play, they would be like, ah, get away. And they'd tell them off, right? They know who's boss. But now it's kind of indifference. It's like, okay, they're here, whatever. That's a subtle change that could be, some people think, oh, they're getting along now. Um, but
Yeah.
usually that's not necessarily the case. It's usually, again, that um, they're thinking about how much energy it takes and any physical discomfort to get away and move, or to turn their head really quickly to
Mm.
give them that little warning sign that that they want enough or that's enough. And on the emotional front, it's again not enjoying or seeking those same things. So when you start thinking about things, oh, he used to love being brushed, or he used to always come running when he heard the can being
The
opened.
cheese,
Yeah, the
the
cheese in the
thought of
fridge,
cheese.
the crinkle from like
Yeah,
the treat bag or
yeah,
whatever.
exactly.
Yeah,
So it sounds like I may be wrong. It sounds like what you're saying is it most of the time pain related, whether it's emotional or physical? Is it mostly because of some kind of pain?
I
Like, is
think so.
pain more of an issue than we think? I know a lot of people say, and you said that earlier, well, my dog is not, he's not in pain because he's not crying. If he's crying, you've
That's severe
already
pain.
missed way too many signs.
That's right. Yeah.
So it's most, okay. So when you're working with dog parent, well, specifically dogs in this case, but
Actually,
had,
Hindi,
oh, sorry.
I realized that I missed one of the earlier questions that you had said. Was there any missed or misunderstood
Oh,
signs?
okay.
Um, and so I just wanted to reiterate, which I said earlier on the emotional front, that some pet parents don't really like think about the dislikes of their pet when they no longer care about those dislikes. So in that example that I shared earlier, it was about a household pet. But what if it's like the vacuum or loud noises
Right.
or a doorbell or the mailman coming, whatever it is that they usually really strongly dislike, now they don't care.
Okay.
That is a potential missed like or misunderstood
Okay.
sign. And I do think that weight loss, especially if it's slow and gradual, that can be easily missed.
Mm-hmm.
Um,
Mm,
especially in the fluffier coat breeds,
right.
because they're so fluffy, you don't always get a chance to see or feel that all of a sudden you're really feeling their spine or their ribs, which you shouldn't be feeling, specifically. Um, and then, as we said, that thinking that, oh, they're not moaning, groaning, vocalizing, so they must not be in pain. Um, or equating those arthritic mobility changes like stiffness, difficulty lying down. Maybe they circle a bunch of times, then they sit down, then they get up, then they readjust their posture on
Mm-hmm.
their bed. Um, all of those changes, that's not just getting old. That those are arthritis and changes related to their joints that are causing them discomfort, and so not taking those signs of pain. Here's another one for little dogs.
Mm.
If you've gotten used to picking your little dog up in a certain way because you know that they're going to vocalize, yelp, yip, that kind of thing,
Uh-huh.
that's because there's pain in that area where you grab them. So that can be often, you just get used to it. You get used to the way that you pick them up that is most comfortable to them. So usually it's avoiding like a sore back end. That would be the case, like the way that you lift them up and hold them. So I really think that as pet parents, we really are attuned to our animals' ways of communication, and they do tell us about their pain. It's just this is being missed because it's subtle, and we don't, without that education, necessarily know what signs to look for. So hopefully, some of the examples that I gave there can share a little bit of
Absolutely. And also from what I've heard, people don't want to bother the vet.
Hmm.
Bother the vet. Any of these things, even
That's what we're here for.
that's what exactly. And if they feel bothered, you better find another vet because they
Yes,
shouldn't be bothered. I mean,
exactly.
I've learned like the tiniest change. I mean, as you learn your dog more and more, I adopt old dogs, so they're already old with issues when I get them. So it's
Oh.
more like they already had it, but it's progressing. But
Mhm.
I know in my case, I have no problem calling the vet or going because you know your dog best. So if you feel there's something, there's probably something.
Mhm.
So when you meet senior dog parents and you discuss all these issues about quality of life, how do you help them track or assess those changes? Um, do you have some kind of scale, which we're going to talk about quality of life later, but the assessment, but do you have any kind of form you provide them with? How do they know how to track it so that, I mean, I guess videos sometimes?
Videos and pictures are very, very valuable. Absolutely. Reflecting back on the way that your dog looked last year versus now, you can see a lot of changes. And other than the gray, I mean,
Yeah.
that's not a concern. But changes even in their posture, the way that they're carrying themselves, um, even in the look of their face, right? Like from a happy dog face to a sad dog face. So those are valuable. Videos, especially for mobility,
Mhm.
and in the way that they're breathing too, because you can get used to subtle changes of that increased breath as being their normal, but then, you look at them in a video of them before, and that wasn't the case. Um, but in terms of tools, I really do think quality of life scales are very, very valuable, if not necessarily for getting a score, which can absolutely be enlightening, but for talking points amongst family members to really understand, um, some of the changes that they're seeing. So, for example, my favorite one that I use is by a veterinarian, Dr. Faith Banks in Toronto. And this is what her scale looks like.
So
And
should
there's
we,
14 different categories.
okay.
Um, and those categories are breathing, pain, appetite and hydration, energy and interest, mobility, elimination and hygiene, gives love, takes love, happiness and favorite things, sleep, anxiety, will to live, burden on you. I want to touch base on that in a moment. Disease, and quality of life. And then you score in each of those categories from 0 to 5. And she gives examples of what it would be. For example,
I'm sorry, I don't want to interrupt you, but
yeah, go ahead.
we're going to talk about that more in depth in the in the next part. So do
Okay,
you mind if we just hold on? Because
of
sorry,
course.
I
Yeah,
just
yeah,
want to talk kind of about the emotional side of making decisions
gotcha.
first.
Okay,
Is that okay?
of
Before we
course.
talk about like the practical, here are the tools.
Yes.
Okay, sorry about that, but um, because I just want to talk about like before we get to that point where they're at the quality of life scale, assessing the quality of life and why it's so difficult. I mean, other than, of course, that we love them so much,
Mhm.
why is it so difficult for pet parents? And how do you, I'm going to leave this as a separate question. Why is it so difficult to be able to step back and assess quality of life? Like they've spoken to you, you've given them the tools of what to look for, but it's just so emotionally hard for them to do it. And we don't want them to not do it and cause their dog more pain or discomfort.
Yeah. Well, I think love is the biggest reason.
Yeah.
We love our pets. Many of us are highly attached to our pets. And it's the highly attached individuals that have the hardest time stepping back and looking at the big picture because we want our pets to be with us as long as possible. And sometimes, for some, that means putting on those blinders and not wanting to really look and assess the realistic, accurate picture. Um, Pets play different roles in our lives. They could be your support, your confidant, your brother, your sister, your child, your family member. And so they're so ingrained in our daily lives that it is hard to imagine them without us. And when we have to start looking at quality of life, that means that we're near end of life. And that is a hard thing to even wrap our minds around
Yeah.
what that future looks like. And it really feels uh, unimaginable. And it hurts because what we're dealing with is anticipatory grief.
Mm.
We are going through seeing the little changes that happen as they age, that loss of their joy of, running with that tennis ball or after that frisbee. That's a grief. That's a loss. There's these little losses that happen. And when we get to a point where we're starting to look at quality of life, because that's what factors in end of life decision making, that means we're there. And that could bring up a lot of emotions surrounding past experiences with past animals that you've had, maybe traumatic end of life experiences, maybe regrets about waiting too long, or the need to feel like you have absolutely done everything.
Mhm.
And maybe there's differences of opinion amongst family members.
Yes.
All these things add this emotional layered um, that is absolutely so hard. And also, we're dealing with denial of what is going on. That's so common, and shock if it's something that's happened suddenly. Um, we're doubting ourselves, what's going on. We might feel guilt or fear, anxiety, overwhelm. All of these emotions are going on all at once. And so to try and just take that moment to really, really reflect and look at quality of life, it's hard. It's just hard.
So you also have to play almost like a therapist role, because I wanted to bring this up. Maybe I'll bring it up later. Just the difference between what you offer. As you're talking, I keep thinking of my own past experiences. And even when I've had wonderful vets, it was never like what you would provide. But it's kind of like another conversation. But how would you support people who are unsure? And we all wanted only let them go at the exact right moment.
Mm,
That's what we want. And, we always say like it's better a week early than a week late. And there is no exact right moment, but sometimes there is a very late moment. But how do you help your patients, clients, who are afraid of getting it wrong?
mm. I think the biggest thing is listening to them, allowing them to express how they're feeling, their concerns, and normalize that and validate that because it's real. It's hard. This is their experience. They're worried about their pet. Everything that's coming up for them is because they love their pet so much. And so the support comes through really, really listening and letting them know that this is a hard time and letting them know that they're not alone, that the support is out there. It doesn't have to exclusively come from me. Who is your support system? Who's your support network? Be around those people. Maybe finding new supports, support groups in the way of different Facebook groups or the Association for Pet Loss and
Mhm.
Bereavement has chat groups for anticipatory grief and chat groups for pet loss as well. So connecting there and just reiterating that there are rarely any clear right or wrong decisions, that rather it's more this range of options, each of those options with their own pros and cons. And so that's where guidance from somebody like me, like a certified hospice and palliative care veterinarian, or a veterinarian that has a passion for supporting pet parents in end of life, is can really make a big difference.
And because I know I've gone to my vet many times, but I don't know. I guess I kind of think that when someone is saying, "Is it time?" They know it's time, but making that phone call is a whole other. That's a leap from I think it's time. But when you have your human clients that are asking you, "Is it time? Is it time?" Is there something you say to them, or do you help them decide when? I mean, I know it's not your decision, but do you give them some kind of tools, or do you actually ever say, I think it's time and here's why?
Yeah, I think that, well, I know that as pet parents, I'm a pet parent, so I can say we too, um, we are the ultimate decision makers, and that's a heavy responsibility
Mhm.
to hold on our shoulders. But partnering with a veterinarian for the support needed in making that decision is very valuable. For somebody who's thinking, is it time? Is it time? I would say to trust their gut and their
Mhm.
instincts. If they're thinking that it's time and constantly questioning if it's time, it likely is time.
Yeah.
But before we just jump right into that, let's have a conversation about all the changes that you're seeing. And just like you said, Hindi, when somebody writes this big, long, like message on your
Mm.
group and they're sharing all these things, but then they're just kind of like, but I don't know.
Yeah.
You know,
How do you not
it's
know?
as you allow somebody to talk about their own experiences, maybe reflect back some of the things that you've heard from them, and guide them in a really supported way through looking at pain scales and understanding how much pain their pet is in, and quality of life scales, that can really make a very big difference in understanding if it's time. Um, but also it is, we have, as pet parents, we do have our blinders on. And so having someone separate from you can be very, very helpful. And also, some of the things that have happened in my world, I would say, is that people have shared with me, say, for example, your kids are off at university and then they come back and they see their dog, and
Mm.
their dog looks completely different from when they saw them the last time they were home, and they express that to their parents. That's sometimes what kind of starts things rolling in the pet parent's head. Oh my goodness, I hadn't seen that or noticed that. And so really, you do know your pet best and are the ultimate decision maker. When it comes to needing that extra support, and I do think that it is time, I will, I generally will say, I do believe it's time. You're making the right decision. Um, and support the pet parent in that decision making process, because there's so much guilt that goes along with the decision,
Yeah.
even when it is the right decision.
Yeah.
So they don't need an extra layer of guilt because the veterinarian that they're working with thinks, well, we could do this, this still, when that might not be what's best for that pet and that pet parent, and those circumstances that are completely unknown to the veterinarian, because it's the person and their world that is really important.
I have to say this now, even it's probably not the right place, because I want to talk about the quality of life scale that you were mentioned earlier. But after speaking to you, and we're only halfway through, but I cannot tell you how much I wish that I had known that you exist. I mean, you're not existing in England where I live. Certainly not any of my vets as wonderful. I mean, I'm in Toronto now, but certainly, even though my vets were wonderful, they had no idea. They were very helpful. Like I knew, but you always go to your vet and say, what do you think? Like, what would you do? We always say that. And then, of course, there's the guilt afterwards because you think you waited too long. There's guilt, whichever side you're standing on. But having someone, because having someone who is in your situation who can really help you, because I know that at least in my experience and many experiences that I read about, it's never about like the other issues, like the emotional and those it's like, oh, your dog is in pain or they're not in pain or they're eating or they're not eating. But having someone like you, or at least a regular vet that's trained in it, makes such a difference. I mean, I'm not going to go into my whole story, but the first time I said goodbye was to a cat, my heart cat. And I had no idea. Like vets don't even talk about this. And I did a video with someone else about planning and also like, because you don't want to hear about it. You don't want to know anything about it. And then I'm faced with a big piece of paper that says euthanasia on it. And he was the nicest guy in the world, but I felt like I thought I was going to be sick. I had no preparation. I didn't even know what was involved. Thank God I said I want her back because maybe someone wouldn't have said it. And then your animal's lost forever. So I think having someone like you and vets that are trained in this aspect makes such a world of difference because people just don't know and you don't know who to turn to. And is someone giving you really good advice and helping you think about all these other aspects that you have shared today. So I
Mm.
just had to throw that in there because I think you're amazing what you do. And I
Thank you.
wish that more vets, I don't want to say care because they care in different ways, but they don't understand, and pet parents don't understand what a big thing this is because we don't want to think about it.
Hmm.
We don't want
Hmm.
to, I never, ever, ever wanted to think. I refused to think about it. And then
Yeah.
here I am faced with, I had to make that decision on the spot because it was the right decision. What do? You can easily make the wrong decision. So I just wanted to put that out there and thank you because what you do is so important.
Uh, thank you.
So anyway,
I
sorry, I
think,
get riled up about this subject because
oh, I do
I've had
too. It's
horrible
so hard.
experiences.
That's the thing about euthanasia. Um, some veterinarians think of it as a procedure, and it
Yes,
it when you stop and think about it, it is so much more than that. It is an experience that stays with us as pet
yes.
parents forever. I mean, if you think on about all the animals that you've had in your life, you remember their ending. It's something that you remember. The ending matters. It's so important. It deserves attention and care. And it is a hard time to think about that. Like you said, we don't want to think about it. But when we do take the time to think about it, it can be equally beautiful as it is sad.
I get so riled up. I'm diverting, but I literally had a cat sit in a freezer at my vet's office for 2 weeks because I was so distraught I didn't pay the bill at the moment. And I kind of assumed, but we had never talked about it because you don't want to talk about even those type of things. I didn't know they weren't going to call me. They were waiting for me to call to pay the bill so they can send him to be cremated. I mean, imagine I never forgot that experience. So
Mm,
oh, I'm so
sorry.
passionate about this, but anyway, it just riles me up because I've had some experiences. Anyway, let's talk about the quality of life assessment. Typically, at least as far as I know, in my limited knowledge, it's the quality of life indicators. And I know there are different ones. There's that H. I don't remember how many H's. There's like 8 H's or something. Or people also suggest getting a calendar, like hanging it on the wall, and at the end of each day, write if it was a good day or a bad day. And again, assessing what a good day is to your dog is what we talked about earlier with quality of life. So there is no, this was a good day. Was it a good day for your dog or
Mhm.
not a good day? And from what I understand, people have also done it like, was this a good morning? Because it's kind of they're that far along. So
Mhm.
those are two. I don't know if those are the only two or there's one that you recommend as a best way for just like day to day, because your vet can do only so much. Like you know, the physical testing, the blood test, that sort of thing, but we're day to day. And for those who really can't see clearly, I would imagine a tool like this would be very helpful.
Mhm. Well, because when we look at quality of life, it isn't in terms of making end of life decisions, it's not just about what's happening today. It's trending those changes over time. Because usually when you start thinking about end of life, it's hopefully not that day.
Yeah.
Hopefully you're thinking about quality of life and have at least a week to before you're making that end of life decision, or longer. So if you're trying to make that decision, the trend of those changes is more important and a helpful insight in kind of deciding when. So your pain scales are say you originally score 3.5 and you're at a 3.5, 3.5, then you get to a 4 and then you're getting to a 5. So that upward trend in the pain scale score, and then using whatever quality of life scale you have that resonates with you, and you're trending lower on the quality of life score. Those are what's going to be important. I do think for like the good versus bad day, it's fairly subjective.
Hmm.
Whereas the scales, help things become a little bit more objective. Um, but what's tricky about the good versus bad days is that it's easy to trick our minds into seeing a good moment that happened within a bad day.
Right.
And and then at the end of the day, we're reflecting, what am I going to write on the calendar? Was it a good day or a bad day? Oh, they did that
Right.
today.
Right. That's
It
right.
was a
That's
good day.
true.
It
That's
was a good
true.
day. You know what? But it wasn't, because we want it to be a good day. We want to see the trend of good, 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 bad, good, 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 good. But in reality, it's likely good, bad, bad, bad,
Yeah.
bad. So, trying to be realistic is where, and more objective is where the scales come in. But let me just back up and say, again, looking at what we're all dealing with in this time, and there's so many emotions. There's all the anticipatory grief, and whatever you're doing to give your pet, maybe it's medications, maybe you're looking at what they're eating. Are they eating enough? All of this like caregiving burden that is placed
Mm.
on you, that you might only have the capacity to do good versus bad on a calendar, and that's it. Because if I'm going to sit down and look at a quality of life scale and try and score this, I'm going to break down and not be able to handle this.
Right. That's right.
And so you just do whatever you can do and leave off that like guilt or of, oh, I'm not doing enough. I'm not doing the scores. I'm not, because you have to move within what's in your capacity. So there are different scales. As I was saying before, I do like the one by Dr. Faith Banks with the 14 different categories that we talked about.
What's her last name? Banks?
Banks, yeah.
Okay. Because I'm going to
Um,
try and put a link to that.
I have it on my website, so I can share the
Oh, okay. That would
link.
be great. I'm going to put
Uh,
your link anyway to your website below, but okay, that would be
we
great.
have a ton of downloadable
Yeah.
resources on
Okay.
our
Perfect.
website, petcomfortvet.com.
I'm
But
going to add that.
with this one, within the 14 categories, it asks you to rank them between a 0 to 5, with 0 being a low score and 5 being a good score. And so, for example, in breathing, questions to ask yourself are a score of 0 would be breathing with severe difficulty and or coughing, wheezing, open mouth breathing. Maybe there's an underlying diagnosed disease affecting their lungs, like congestive heart failure, lung cancer, or laryngeal paralysis. So that would be on the 0 end. To the 5 end, being breathing normally, has a resting respiratory rate of less than 30 breaths in a minute. And so I teach pet parents how to
Okay.
um, how to do the resting respiratory rate, because it is so, so, so valuable.
Wow,
When
that's
your dog is at rest and not expending any energy, they should be breathing less than 30 breaths in a minute. If they are breathing more than that, there is something going on of concern. So then you would rank it, let's say, they breathe normally. It's very comfortable, normal, but their resting respiratory rate is 36. So maybe I'm going to score that a 1 or a 2, because they're definitely not breathing with severe difficulty. There's no coughing, wheezing, any of that
mhm.
stuff. So that's a 2. So you go on through the scale, you score everything. And then what I like about this quality of life scale is that at the bottom, it breaks your score into a percentage and then into quarter percentages. So your top 75 to 100% is an excellent quality of life with no obvious palliative care required. Your bottom 25% is very poor quality
Mm,
of life, and you should strongly consider a humane euthanasia.
okay.
Your lower 25 to 50 is a poor quality of life, and we really must immediately look at what we're doing in our treatment plan to improve comfort and pain and quality of life, or euthanize.
Yeah.
And what most people score when they come to me and they're in that, I don't know if it's time, is a score between 50 to 75% in this scale. And that is a decreased to good quality of life, and assess if palliative care is required. That's how this scale scores, and how you can kind of use it to help in making decisions and then trend over time. So if you scored, a 75 today, 75, 75, then it's 68, and so just monitoring that. Um, the Ohio State University has a scale with questions to ask yourself, and then the answers are strongly agree or strongly disagree.
Hmm.
And then you circle them, and it's a visual. If you have more
Right.
circled here, it's a poor quality of life. If you have more circled here, it's a good quality of life. So this might be helpful for more visual people. The the scale, as you mentioned, or I call it also H5M2. We kind of revamped it into our own scale here too,
Okay.
that actually gives you more examples within each category than
Right.
there do. So that's the hurt, hunger, hydration, hygiene, happiness, mobility, and more good days than bad.
Right.
So a lot of those, like the past scales, like these two scales, the H5M2 and the Ohio State, they take into account a lot of the physical aspects of quality of life.
Right.
And one of the reasons why I like Dr. Faith Banks' scale, and recently Dr. Mary Gardner of Lap of Love came out with a dog quality of life scale as well. Um, and her categories are sleeping, mentation. So that's like their headspace. Appetite and thirst, elimination, mobility, appearance, breathing, vision, hearing, pain, or discomfort. Um, what I like about these two scales is that they include some emotional
Mhm.
levels of well-being, and they include in this one here says the burden on you. So, for example, score of 0 is not causing a physical, emotional, financial, or time-consuming burden on me.
And that's interesting to include like caregivers to measure their own burnout on there.
It absolutely
That's
is.
very interesting.
It is quality of life does not just refer to your pet, it does refer to you. What's going on with your pet impacts you. Your resources and what you have in your buckets of physical, emotional,
Yeah,
time, financial, also social too, right? So like
yeah,
sometimes you're staying home, you're missing out
absolutely.
on everything because you want to be there with your pet. Um, that has to take into account and consideration. For sure it does.
I've seen people talk about, well, I don't want to murder my dog because it's expensive or because I'm having trouble mentally because I can't cope anymore because I'm doing this alone, but I can't murder my dog. So that's, although they're falling to pieces, again, I base it on my experience with other senior dog parents. They can't use that as a reason.
Mhm. Well, first thing I would say is the word murder.
They've used the word murder.
Oh,
I'm
I
like,
know.
it's
Oh, I
not
know.
murder.
Kill.
It's,
I don't want to
oh
kill my
gosh.
dog.
Yeah.
Murder, kill, for
Oh my
example.
gosh.
So let's just remember that murder and kill comes with intent, and
Mm,
it's a harmful intent. When we euthanize, it's something we do for our pets, not to our pets,
yeah.
and it's in a loving intent to help end their suffering. Um, and with respect to somebody sharing their concern surrounding, I don't want to euthanize my pet merely because they're a burden on me or it's hard to care for them.
Yeah.
My response is, but why is it hard to care for them? What is the pet experiencing that is making it hard for you to care for them? Because if we take the hardships of what we're experiencing as people and put it back to the pet's experience, that's when we can see that, it's hard to constantly clean up. I'm not going to say goodbye to my pet because I'm constantly cleaning up accidents. I can't do that. I can't just make that decision.
Right.
But but then, okay, well, let's reframe that. Let's look at that. What is your pet's experience? Do they constantly want to be having these accidents? How does that impact them and their dignity
Yeah.
and what they're experiencing? So that's something that I do. It takes time because this is a mindset.
Yeah.
And
Absolutely.
so it takes time to come back to the reality of looking at the whole big picture and that there's a lot of contextual factors that we might not be aware of in that decision making. So the more we open things up to a non-judgmental, safe place to share, the more as I get an opportunity to really understand what's going on in the home that is contributing to the caregiving burden. I could also help make some suggestions like, well, is there a pet dog sitter that
Hmm.
could come for one night so you could go out for dinner? Just to give you a little bit of respite care, a little bit of relief from that. So it does. It does matter. Carrying the emotional component, The physical component, large breed dogs with mobility that are having
Yeah,
struggling with
yeah,
getting up and
yeah.
down the stairs. Absolutely, that's a physical concern.
Uh,
And
yeah.
yeah,
No, I was going to say what you said about kind of turning that around is brilliant when it comes to caregiver burnout and I'm falling to pieces. But why are you? And it goes back to your dog's quality of life. So that I had never thought of it like that.
mm,
Brilliant. So one more thing about the tools
mhm.
before we move on. First of all, how is this a daily thing that they would do? And also, how can a pet parent use that tool without getting like hysterical and freaking out every time? Or if they are, it's time to have a chat with the vet.
Yeah, I think it really depends on where your pet is at in what they're experiencing, what disease they're experiencing,
Mm,
and the typical disease progression, and where they score at the time that they reach out to me, that I would share, use these tools daily, or use these tools twice a week, or use these
okay.
tools weekly, um, as a general guideline. But of course, pet parents can do whatever they feel feels right for them. Um, and I absolutely understand and can appreciate that fixation um,
Yeah.
on looking at specific things. Like I wrote a blog about my experience as a my dual mindset as a caregiver for my cat Smokey, who is the instigator um, of me turning towards end of life care,
Oh,
um, and the mindset of a veterinarian, and just the struggle that I experienced in his end of life journey. One of them was his appetite. He wasn't eating. And I was constantly on, okay, I offered this today, this many kibbles, this is many kibbles are left. I offered this much canned food. Okay, I'm going to switch over to this canned food. I'm going to see, is he eating? Is he eating? Well, cats don't like you watching them
yeah.
eat, so he's not going to eat. So it was just this eagle eye. And
Yeah.
so it's hard to step back and like not be so like focused on this, because this stage of life, this end of life stage, is a very important time. Just taking a moment away from the tools, away from the questions, the worries, and just petting your pet. Um, but I do think it's a mindset, a personality, and caregiving burden component that all mismatches with avoiding using the tools in a way that suits you and your personality, and being okay with maybe not using them as often as maybe what was recommended,
Mm.
because that's all you can do. That's okay. Um, so, like I said, I'll provide these tools. If they're helpful, use them. If they're not helpful, don't, and don't stress about it. Um, and then, like I said, the mindset of the beautiful time for connection with your pet and being with them in the present moment, like they live their lives.
We did touch on this before, but I'll tell, even if we did, it bears repeating because it's something we all deal with. The waiting too long. Um, I should have done it sooner. I did it too soon. I need to know exactly when. Yeah.
Yeah.
What do you say?
Yeah. Um, so I do think that we do the best that we can do in that time, with those levels of stress that we're experiencing, that what's going on with our pet, with the information that we have at that time. And that's what we do. We do the best at the time. And it's only when we look back with in hindsight
Yeah.
that we start to really question. And the only benefit of the hindsight in reflecting back on the experience of what it was is to make decisions that feel better next time with your
Mhm.
next pet. And because it's our past experiences that shape us in who we are and what's important to us so that we can make better decisions with our current other or future pets.
And
Um,
yeah, sorry.
um, so I think with chronic conditions, there's this time frame between a good quality of life and sustained suffering. And that time frame can be very long, very subjective, and what feels right for one person might not feel right for another person. And I think that what that's showing is we're taking into account our pet's personality, their preferences, the personal circumstances. And so it is absolutely okay that one person euthanized their pet earlier than another
Right.
person who euthanized a little bit later. Because guess what? That earlier pet, they refused their medications. We could not give them anything. We tried 10 different ways, 10 different medications, liquid versus capsule versus, all the things that we tried. People aren't aware of that. And so if someone has the audacity to judge you on when in this horrible progression of disease that you're witnessing your pet experience, how dare they? They don't walk in your shoes. They don't know what you were experiencing, what your pet was
Mhm.
experiencing, or why. And so if somebody is going to judge that, you don't want to be around those people and be around your tribe of people who understand you, your bond with your pet, because you made the decision that was right for you and your
Absolutely.
pet in that moment.
I want to just add one thing about guilt that I certainly had experience with. We tend to judge based on the new information that we have. And I did that for a long time. But you can only make a decision based on the information you have in the moment. The fact that I have this many more years of experience since some horrible thing happened, which, I really fell into a hole over, took me a long time to convince myself, but I didn't know what I didn't know. And that's a very difficult place for people to be,
Mm-hmm.
but you didn't know.
That's right.
So is there something you wish more people understood about end of life decisions?
Um, I would say that I would go back to the idea that, first of all, there's no right or wrong decision, but a range of options, each with its own pro and con. And that choosing euthanasia is not giving up. It's a compassionate, loving decision to prevent suffering for your pet. Um, I also think that I would want people to know that when you when you maybe consider like, have I done everything that I can? It's everything that I can, not everything that you can. So
Right.
just because something is available, that there's XYZ that's possible, it doesn't necessarily mean that that's the right choice for you and your pet. And so I think I think that it's very important. Even as a veterinarian, I know the what gold standard options are available to me, and I can choose not to pursue those. And does that make me any less of a pet caregiver lover? Um, it's hard not to judge ourselves and feel guilty that we haven't pursued those other options. So I think just the biggest message like I want to say is that it's it's okay not to do quote unquote everything. You do everything that you can.
There is a great quote that I never forgot. There was a very well-known vet in the UK. He had a show and he was talking about something and he said, just because there's something that can be done doesn't mean it's morally and ethically right to do it. And I always have that in the back of my mind. And I love that
Mm,
because
I do
some
too.
people like heroic measures, they do it to keep their animals with them, but it's not for their benefit. And I love that quote and I use it often because I think it's helpful. So if
Mhm.
we can move on to, does hospice care change the way we think about quality of life? And if so, how? Because this is a whole other aspect of veterinary care that I'm not sure how many people are aware of.
Mm, yeah. Um, oh my gosh, Andy, I just turned my page and realized I have more things that I wrote
Well, how much
about.
time do you have? I could sit.
I know. Well, so, okay, let me just like spit out
We
quickly
could
a
always
few
have
things.
another conversation.
A few things first that I wish more people understood about end of life decisions.
Okay.
Okay, so support is available. I wish that people knew that support is available, that home euthanasia is available, and that euthanasia can be a beautiful experience. Um, I'm not going to expand on those comments like I had intended to, but those were things that I wish that more people knew surrounding end of life. And then with respect to hospice and palliative care, I kind of took this two ways. The first is um, from the perspective of like a veterinarian, those trained in hospice and palliative care, they understand like the multi-layered pet and human factors that go into evaluating quality of life and can help guide end of life decision making. That perhaps don't, those veterinarians that perhaps don't have that experience, that training, or that passion can provide. So I do think that hospice and palliative care from a like a trained professional vet makes a difference in how we look at quality of life. Like I've had people that have used me in their quality of life consultations that have shared that they've gone into their vet for a quality of life consultation and it's a 20-minute check over of their pet
Mhm.
and conversation, whereas mine are usually 1 to 1.5 hours of conversation and it touching on so many more things. Everyone that I've circled back to ask them if I was able to meet their expectations for what they were hoping to get out of that consult has shared yes, that they felt more clear and more confident in their end of life decisions. So when it comes to hospice and palliative care, from a vet perspective, I do think that it changes the way we evaluate and think of quality of life. From the act of providing hospice and palliative care to your pet as a pet caregiver, I do, yes, likely think that it does because there's more focus on comfort and relief of symptoms. So if you are starting out, it could be a poor quality of life. Then we start getting hospice and palliative care going, and that quality of life can actually improve for
Oh,
a little
wow.
bit.
Wow.
And then, of course, the inevitable
Mm.
decline in quality of life. And hopefully, in partnering with a hospice and palliative care veterinarian, having that disease education and conversation about stopping points or end points that help in decision making, we can take that change in quality of life and make the decision for euthanasia or hospice assisted natural death, if that is someone's preference, and um, and make that decision in a way that feels good and avoids suffering. But it's hard to, of course, there's the balance between that desire to extend your pet's life
Yeah.
with the responsibility to ensure their comfort. And that's why it's not about quantity of life as much as we want them with us forever. It is about quality of life. We want them to have a good life while they're here.
So what does a good final chapter look like to you, ideally?
Mm. I guess like if I were to say a general statement, it would be that it's one where the pet feels safe and comfortable and connected to their people, and free from unnecessary suffering. To kind of go in more, some of the points that I thought of was a good final chapter looks like honoring the bond and the connection that you have with your pet. It looks like meeting their needs and allowing them a sense of agency and autonomy, um, and taking into account or aligning with their personality and preferences. Uh, so that's like where I was saying that if your pet is diagnosed with a disease that is manageable with medications, but they absolutely refuse those
Hmm.
medications, that is them speaking to you. And so it's honoring that and knowing that it's okay to make that decision because they're making that decision.
Right.
So and of course, a good final chapter looks like managing their pain. It's walking the path of least regrets. It's finding a strong support system. It's allowing yourself permission to feel all the feels that come in this and know that it's okay. Giving yourself compassion because this is hard. Um, a good final chapter looks to me like a good death
Mm.
experience.
Yeah.
And beyond that, time to heal and time to grieve.
Have you found that a person's like personal beliefs or spiritual or religious beliefs have affected how they make a decision?
Yes, absolutely. And I think that it's important that those personal, spiritual, cultural beliefs um, are shared with the veterinarian
Hmm.
that you're working with so that we can then help maintain that focus and find the balance between those values and the responsibility that we have to prevent suffering. So, for example, if your beliefs are against euthanasia, then it is working with them to educate them on what the disease progression looks like, what changes to expect, how to maintain comfort throughout those changes, and what a natural death looks like, what to expect, how to support them through that, and hopefully look at something like a hospice assisted natural death where there's still relief from any potential suffering, but it's not in the form of the final injection that causes their peaceful death.
Is natural death, I don't like that word really, but is it really possible that it would be pain-free? Or do you actually see sometimes they're just not budging and the animal's suffering and there's nothing you can do?
That's a hard one. Um,
Like,
I,
can you
I
ever get
think
through to them?
I think that it again it depends on what the condition is of the pet. Um, some sudden deaths, if they're heart related,
Mhm.
can be very quick and pain-free, um, or minimal pain. But if there's any concerns about breathing, there may not be physical pain to the pet, but there is anxiety
Mhm.
because I don't know about you, but if you think about any time that you haven't been able to breathe
Mm.
right, there is an anxiety that comes with something that's supposed to happen so naturally that we're unconsciously aware of now becomes the center of our world. And all we're focusing on is being able to take that breath. And so when the breathing changes start to happen, there definitely can be an anxiety. And so is that pain? No, but it is a shift away from comfort. So again, it really depends on each disease process of what is causing a natural death. Um, but for the most part, I would say when you ask someone what um, what would be your end of life wishes for your pet, and someone shares, I just wish that they would just make the decision and
Dying in
die,
sleep.
go in their sleep without me having to make that decision.
Yeah.
And I get that. I do get that. Um, but the act of euthanasia is helping a pet die in their sleep. The first step of euthanasia is allowing the pet to drift into a deep and comfortable sleep. And then the final step is a medication that acts like, um, on the brain level of the brain, stopping the brain before the breath changes, before the breath stops, and before the heart stops, so that when the heart does stop, there's no sensation of pain or worry or anything because the brain has already stopped. So
Mhm.
it's not like a heart attack. There is no pain in a euthanasia. Euthanasia means good death.
Yeah.
We want it to be a good death experience. Um, but what I would actually say is, other than the death experience of the pet, what is it that you want as a person in their end of life experience? Do you want to be with the pet so that they're not dying alone? A natural death, you might not be there.
Right.
How would it feel if you came home from work and you found your deceased pet, or you woke up? Maybe you heard something. You woke up in the middle of the night, you heard something, and you find your deceased pet. I've experienced that. And I will tell you, the look on their face, I will not forget. And it wasn't a good feeling not to be there with them.
Yeah.
So if that's important, then that's where euthanasia allows you the opportunity to be present with your pet and to offer them the that transition from awake to sleep to death.
That's fantastic the way you said that. I want my dog to go in their sleep. Well, okay, so now you can. That's, wow, I never thought of it like that. Last two questions. Um, what would you say to someone who's dealing with so much worry about their dog right now? Because it's just worry and, we miss the moments.
I would say that you're not alone, that this time can feel so isolating, especially as the burden of care increases, and to seek support, the support that you need. Who is in your support network? Is it a pet sitter, family member, vet, a technician, mental health professional, pet loss support group? spiritual advisor, talk those things out. It's important.
So the last question, I mean, there is so much that everyone can take away from this conversation. I've learned so much. It's been amazing. But if they could take away just one thing about quality of life, um, what would you want it to be? Let's say they couldn't watch the whole video, even though they're missing, and they got to the end. What's the one thing you want them to take away from this?
Mm. Ooh.
Just watch the video. I mean, you have to watch the
Yeah.
video.
Um,
It's fantastic. And can I just say that I think that it will help people see euthanasia in not such a horrible and scary way.
mm, thank
Oh, that's
you.
my takeaway, but
Um, I think, okay, so quality of life, it's about preserving comfort and dignity, moments of joy. And when those are no longer possible, helping them pass peacefully is one of the kindest things that we can do.
absolutely. Well, thank you so much. I cannot tell you how grateful I am for this conversation. I've learned a lot, and I know that other senior dog parents will learn so much. And I honestly believe that it will help them not only prevent suffering or stop the suffering that their pets may be going through, but just learn that this whole process does not have to be hard and scary and depressing all the time, as much as it is, but it could also be a beautiful thing.
Yeah. Thanks for, thinking of these really thoughtful questions that we as pet parents experience, and being able to have this conversation with me and share it with your network and get it out there, because I think it's just so important that we don't feel alone.
Absolutely. That is the one, that's why I started the group, because I realized if I have no one to talk to, other people are alone too. And that's the one thing that will make all the difference is people know that they're not alone. So, Dr. Erica, thank you so, so much for giving so much of your time, but it's an
My
important
pleasure.
conversation. I'm grateful. Anyway, take care. Have a wonderful day. Bye, everybody.